So data, like Victoria said, it's so nice to be able to look at a number. And I know people say like a picture speaks 1,000 words. I think sometimes a number can do that as well.
Yeah.
And it really illustrates in a simple way what the priorities are. So it's so crucial in measurement and planning. At Algoma OHT, we're using data daily to identify system gaps, understand community needs, measure the impact of initiatives, and support more informed decision making. So we do this through a variety of ways and with lots of different tools. So we have access to things like the Ontario Health Data Dashboard, which is a provincial site where we're able to get a lot of really crucial insights. We also use more public-facing databases like the Canadian Institute for Health Information and Statistics Canada. And then we also get some internal reports, and we also develop our own data sets when needed to get that true Algoma-centered insight into different projects we're working on. So this all allows us to get really valuable numbers and see where system strain might be occurring, what some underserved populations are, differences in maybe some provincial or national targets, and morbidity rates. I'd say also when we're evaluating data for impact and program initiatives, Raylene brought up COPD earlier, and I think that's a really good example. So data is really the backbone of what we're collecting when we first started this initiative. And with that, we're able to track things like referrals, how many referrals are taking place, how many people have been diagnosed with COPD. And then on the pulmonary rehab side, we're able to track symptomatic improvements, patient experience, quality of life, very important numbers needed to continue to push this work forward and for us to see what's working, what might not be working, and just the sheer impact we're making on individuals' lives with things like COPD. I think also from a broader planning perspective, data is really helpful for us and our partners where we're able to identify needs and move them forward by gathering data that helps them with whatever initiatives they're looking for as well. So I'd say overall, data is something that we use every day, and I think everyone usually accepts it and very positively, and it's a nice visualization for lots of initiatives.